distinguished ministers, excellencies, representatives of international organizations, dear colleagues and partners. It is a pleasure and an honor to join you at this regional forum on the care economy in Europe and Central Asia. I would like to thank UN Women and all partners for organizing this important forum and for bringing attention to an issue that is becoming more and more important for our societies and economies. Across our region, we are facing important demographic and social changes. We see aging populations, migration, labor shortages, changing family structures, and continuing inequalities between women and men in the labor market. These challenges require us to rethink how care is organized, unsupported and shared in society. Care is not only a social issue, it is also an economic issue. Care work supports families, communities, and economies every day. However, much of this work remains invisible and unpaid, and it is carried mainly by women in Albania. Women spend an average more than 5 hours per day on unpaid care work, while men spend less than 1 hour. This inequality distribution affects women's opportunities to participate in the labor market, to continue fully in public life. At the same time, investing in care services creates benefits for the whole society. Expanding childcare, services for older persons, disability services, and community-based social services can create jobs, support women's employment, strengthen local economies, and improve social inclusion. Recent studies in Albania show the important economic value on the care economy. They also show that investments in care services can help create formal unemployment, increase social contributions, and support economic growth. Targeted measures to support women with care responsibilities, including the coverage of social and health insurance contributions for approximately 9,000 unemployed women with 3 or more children, contribute to strengthening their economic security and recognizing the value of care work. For Albania, this discussion is also closely connected with our European integration processes. The European Care Strategy and the new European Union Gender Equality Strategy 2026-2030 provide an important framework for strengthening inclusive, accessible, and affordable care systems. Albania is committed to aligning its reforms with these European priorities and standards. In recent years, Albania has taken important steps in this direction. The National Strategy for Gender Equality till 2030 includes objectives related to women's economic empowerment, work-life balance, and the care economy. In addition, the new law on gender equality recognizes unpaid care work as an important contribution to family and society. Albania has also continued to expand community-based social services through the Social Fund and other national programs supporting children, older persons, persons with disabilities, and vulnerable groups. We are also continuing reforms related to deinstitutionalization and integrated local social services. At the same time, we recognize that important challenges remain. Access to early childhood education and care services is still below European targets, especially for children under the age of 3. Demand for long-term care services is increasing because of demographic aging. Rural and unserved areas also continue to face difficulties in access to services. Addressing these challenges requires stronger policies, sustainable financing, and stronger local capacities. In this regard, gender-responsive budgeting is an important tool for Albania. Our country has made important progress in this area, and we increasingly see the care economy as an important area for public investment linked to gender equality, employment, and social development. Municipalities also have a very important role. Local governments are not only service providers, they are key actors in designing and delivering inclusive care services for citizens. Strengthening local planning, financing, and service delivery capacities will remain very important in the future. In this process, Albania highly values the support of international partners, including UN Women, UNICEF, International Labour Organization, United Nations Development Programme, the European Union, and many other partners supporting inclusive and evidence-based reforms. Transforming care systems requires cooperation and long-term commitment. Governments, local authorities, civil society organizations, international partners, communities, and the private sector all have an important role to play. Albania remains committed to contributing actively to this regional effort and to advancing policies that place care at the center of social inclusion, gender equality, human development, and sustainable economic growth. Because in the end, the future resilience of our societies will also depend on how we value care, how we support it, and how we share responsibilities more equally between women and men. Thank you very much.